name's Jennifer. I'm checking Megan off on Musculoskeletal on November 5th.
I, Louis Gallo, hereby give my written and verbal consent to be filmed in Liberty University Nursing Exam Suites in the Nursing Department at Liberty University as part of the Nursing 210 Adult Health Assessment, Nursing 221 Fundamentals of Nursing course. I understand that giving my consent to be filmed, I also give my permission for the film containing my image to be submitted to a secured YouTube site viewable by the nursing student and instructor of the course. I understand that during the examination and filming, areas of my body will be uncovered, exposed, inspected, palpated, percussed, and auscultated by the student nurse. With this understanding, I give my consent.
Alright, and she's already signed the paper. Hi, my name is Megan Carey. I'm the Liberty University nursing student, and I'm going to be doing your musculoskeletal exam today. Is that alright with you?
Yep.
Alright, and can I have you please verify your name and date of birth, please?
Louis Gallo, January 19th, 1995.
Alright, and I've already practiced good hand hygiene by washing my hands before I started this exam. So can I just have you start the exam by standing up? And can I have you walk to the other side of the room and back for me? Alright, my patient's gait and posture looks good and his ability to stand seems normal. And so I'm going to have you stand with your back facing me. And so can I have you touch your toes, please? And come up very slowly. Alright, and the alignment and contour looks good, and the bones look to be symmetrical on both sides, and I see no abnormalities such as kyphosis, lordosis, or scoliosis. And so you can go ahead and sit back down. And the muscle characteristics look good. I see no masses, spasms, edema, atrophy, hypertrophy, or any increased tone irregularities. And so now I'm just going to palpate your joints, if that's all right with you. Alright, and I feel no swelling or heat or crepitus or any, he doesn't seem to have any resistance to pressure. And was anything that I touched tender?
Nope.
Alright, and that's good. And so on functional assessment of my patient, he looks to be well kept with good hygiene and looks like he takes good care of himself overall. And so now we're going to just start by doing some range of motion testing, and then we're going to test those joints too. So we're going to start with the temporomandibular joint, so like your jaw up here. So what I want you to do is open your mouth, close it. Now push your jaw to the side. Now the other side, and now jut your jaw out. Alright, and so we're going to add some resistance to that. So I want you to open your mouth, close, push your jaw to my side. Now the other side. And now I want you to jut your jaw out. Okay, good. And now we're going to do the cervical neck and the spine. And so what I want you to do is I'm going to do forward flexion. So you're going to do that, and now backwards hyperextension. Alright, and then we're going to do ear to shoulder, so laterally. Now the other side laterally. And now we're going to do rotation. So I want you to turn your head to the right, so like that. And then the left, like that. And so we're going to add resistance to that now. So push your head down. Now back up. Now push your head into my hand. Okay. Now the other side. And now we're going to do rotation. So push your cheek into my hand. Now the other side. Okay, good. And now we're going to assess the shoulders. So I want you to hold your shoulders out in front of you. Your hands out in front of you. And now that's forward flexion, and we're going to do backwards hyperextension, so back here. And now we're going to do abduction. And now bring them in front for adduction. And now we're going to do external rotation and internal rotation. And so to assess the strength of that, I want you to hold your arms out in front of you. Okay? And hold them there as I try and push them down. Okay, good. And now I want you to hold your arms out to the side and keep them out there as I try and push them in. Okay, good. And so now we're going to assess your elbow, and I want you to hold your arm out like this, and now flex it back. And now we're going to do supination and pronation. All right, now to test the strength of your elbow, I want you to flex it like this. And I want you to keep it there as I try and put it into extension. Okay, good. Now I want you to extend your arm and hold it there as I try and flex it. Okay, good. And now we're going to move on to the wrists. And so I want you to do flexion, extension, hyperextension. Okay, good. And to test that, I'm going to have you do flexion like this. Now hold it there as I try and straighten. Okay, good. Now hold it into extension while I try and flex it. Okay, good. And now we're going to assess your grip. So hold your hands out like this and take my hands. Now assess. Is that all you got? Okay, good. Now we're going to assess the hands and the fingers. So I want you to do abduction, adduction, and now I want you to make a fist. Okay? And now I want you to hold your fingers up like this and touch each of your fingers to your thumb like this, and then the base of your pinky. So down here. So 1, 2, 3, 4, and then 5. Okay, good. And to assess the strength of your fingers, I want you to spread them out like this while I try and close them. Okay, good. Now I want you to flex them like this, or hyperextend them like this. Extend up like this while I try and push them down. Okay, good. And I want you to flex them like this while I try and straighten. Okay, good. And now we're going to move on to the foot and the ankle. So I want you to dorsiflex, so I want you to put it up like that, and then down, plantar flexion, and then I want you to put your soles out towards the walls, good, and that's inversion, and then towards each other, and that's eversion. And now I want you to dorsiflex up like this, and hold it there where I try to push, good. Now point your feet down for plantar flexion, and I'm going to try and put them up. Okay, good. And now to assess the strength of the gluteals, the abductor, adductor muscles, and the hamstrings, I want you to sit like a girl. All right, now switch. Good. Okay, so now I'm going to have you lay down, and we're going to do some range of motion on your hip. Okay, so I want you to do a straight leg raise for me. Okay, and back down. And I want you to bring your knee to your chest. So bend it. Okay, good. Put it back down. Now I'm going to have you do a straight leg raise, and then put it medial towards the wall, and then bring it out laterally towards me. All right, you can go ahead and put that down. And now I'm going to have you put your heel on your knee on the opposite foot. Okay, so stretch it out like this. That's external rotation. And then we're going to bring it out and stretch it like this, and that's internal rotation. And so to test the strength of your hips, we're going to I'm going to put my hand here, and you're going to do a straight right leg into my resistance. Okay, good. And now I want you to spread your legs apart into my resistance, right? And open it back together, and try and put it back together against my resistance. Okay, good. So now we're going to move on to the knee. And so I want you to bend your knee up as far as it goes. All right, now straighten it and stretch it. Okay, good. And so I want you to bend your knee against my resistance. Okay, now I want you to keep it bent as I try and pull it down. Okay, good. So you can go ahead and stand up now. And I want you to take one of your legs, choose whichever one, and I want you to pull it back so we can test your hips backwards extension. Okay, good. And now we're going to move on to thoracic. And so I want you to touch your toes, come back up, and lean back as far as you can. All right, stretch to the right, now stretch to the left. All right, and now I'm going to come behind you, and I'm going to stabilize your hips. And I want you to rotate out like this to the right, and then the left. Okay? To the right, left. Okay, good. And for all of these exams, we would do them bilaterally, meaning both sides for all the ones that we didn't cover. And so thank you very much, and the doctor should be in to see you soon.